Good day and a warm welcome to each and every one of you. Thank you for joining the Vanderbilt University School of Nursing Global Collaborative Series. This is a platform dedicated to exploring the diverse landscape of advanced nursing care around the world. My name is April Kapu, Associate Dean for Strategic Partnerships and Global Affairs here at Vanderbilt, and I will be moderating today's session. Please let me take a moment now to thank Megan Allen, who is our DNP leadership student, and to all of my colleagues and coworkers who have worked so hard to develop and implement this program. The purpose of this series goes beyond borders. It's a journey to learn, to understand, to foster connections that may lead to meaningful collaborations in the realms of advanced nursing practice, education, and regulatory frameworks. This series serves as an open invitation to communicate, share experiences, and collectively contribute to the enhancement of advanced nursing care on a global scale. As we embark on this journey together, we'll be using the familiar Zoom format for today's session. I kindly request that you keep your microphones on mute during the initial portion of this presentation to ensure a smooth experience for everyone. Rest assured, there will be opportunity to engage with our speaker and have questions and comments once the presentation concludes. And now, without further ado, please let me introduce our esteemed presenter for today, an expert in the field of nursing who will guide us through valuable insights and perspectives. Bongi Sabanda is an advanced practice nurse. She's a leader on an academic and professional realm with expertise in international healthcare workforce education. She is a member of the International Nursing Recruitment Advisory Group at NHS England, an editorial board member and international committee member at the American Association of Nurse Practitioners. And she is a Florence Nightingale Global Scholar Advanced Practice Nurse Leader. In 2018, Bongi led the Anglophone Africa APN Coalition Project supported by the ICN, International Council of Nurses, APN Network, Nursing Now, and a number of APN global stakeholders and leaders. Subsequently, she presented this work to the World Health Organization and made recommendations for Africa included in the ICN APN guidelines. Currently, Bongi holds an advanced practice organizational leadership role at NHS Trust in England. Please join me in welcoming global expert Bongi Sabanda.
Thank you, April, and thank you for the kind introduction. It is an absolute honor to join today, and thank you for the invitation and the work done behind the scenes by everyone at Vanderbilt and Megan in actually bringing this together. I look forward to sharing today with colleagues on the advanced practice education regulation and practice in the United Kingdom of Great Britain and Northern Ireland, otherwise normally known as UK, but you'll find out why I am going to be including the full official name for the United Kingdom. So yes, as April said, I am an advanced practice lead, corporate lead, similar to what is called Director of Advanced Practice from a US perspective at an NHS trust that is not very far from Birmingham, so in the middle of England. And really, I will start firstly by giving you an overview of the United Kingdom of Great Britain and Northern Ireland. As many of you will know, the UK is made up of 4 nations: Scotland, Wales, England, and Northern Ireland. This is so pivotal to understand from a geopolitical perspective in advanced practice, particularly with reference to education and regulatory processes. And you'll see later on when we talk about Northern Ireland and Ireland, particularly the implications of the Good Friday Agreement of 1998, why it's important to have regulatory processes and education processes that overlap between Ireland and Northern Ireland, but while it's keeping Northern Ireland within Great Britain as well. So each of the 4 nations have a chiefness. They've got their own governments as well. So there are differences in regulatory. While most of the regulatory parliamentary work happens in Westminster in England, there are other areas of legislative processes and policies that happen in each nation. So I'll first start with the Northern Ireland. Northern Ireland has its own chiefness, just like all the other 3 nations of the United Kingdom as well. Maria Malcolm is the chiefness. And Northern Ireland is very unique in that it has a advanced practice framework that's specific to professions, and advanced nursing practice is very specific to Northern Ireland compared to the rest of the United Kingdom. So this is critical because United Kingdom overall approaches advanced practice in a multi-professional perspective, and this means that advanced practice nursing in Ireland sort of matches with that in Northern Ireland. And I'm sure when my colleague comes and speak about Ireland in the next series, you'll also understand more on this impact between Northern Ireland and Ireland. However, Northern Ireland, as part of the United Kingdom, is under the same regulatory nursing and midwifery processes like the rest of the UK. So the Nursing and Midwifery Council is the regulator for nursing and midwifery here in the UK. But also the Royal College of Nursing, which sets standards for advanced practice, as well as other nursing standards as well in the United Kingdom, and is the member of the ICN. It actually covers all the 4 nursing areas and all the 4 nations, including Northern Ireland. The latest framework was published in 2023 last year, which was an update of the previous advanced practice nursing framework, very much uniprofessional and very much articulating what advanced nursing practice looks like at all levels. And Scotland, which is very unique in that it has always had an advanced practice, very standardized between the 2 common roles that are there international, the APN roles, so the nurse practitioner and the clinical nurse specialist roles. Until fairly recent, it has moved then to the multidisciplinary advanced practice. And of note is their recent multidisciplinary rural advanced practice capability framework with a focus really on the rural population, which is about 17 to 20% in Scotland. The curriculum and the main areas of specialties are adult pediatrics, neonatal acute care, adult pediatric mental health, and adult pediatric community care. There is also a network of educators that feeds into the overall UK education network, the AAPE UK, which I'll speak about later on. So the Scottish Advanced Practice Educators Network, SAPEN, was formed in 2021. It is multi-professional and feeds into the AAP UK. Chief Nurse Professor Alex Mohan is the Chief Nurse for Scotland. And Scotland also has a representative, just like the other 3 nations of the UK, within the current work on advanced practice regulation with the NMC. I'll talk more on that later as well. But of interest is that the ICN-NP APN Network conference this year is in Aberdeen. So I hope to see many colleagues in Aberdeen in September this year, and hope you'll be able to join us. Then Wales. Wales is unique in its own as well. It's got a framework of what you call enhanced level, which arguably is a specialist role, and that includes specialties in emergency nursing, specialties in physiotherapy, musculoskeletal, and so on, but also the advanced practice and consultant clinical practice work. So this is a fairly developed recent framework and encompasses the multi-professional approach. But obviously, from a nursing and midwifery perspective, Chief Nurse Sue Tranker, as the government chief nurse for Wales, oversees the nursing and midwifery standards and perspectives for the country. They have the practice educator networks as well that feeds into the AAP UK, and that was established in 2020. Then I'm going to spend some more time really discussing about the England, because England has taken the lead in the multi-professional advanced practice place, which has come with some of unintended consequences, as you'll see, but also has overall come with some positive outcomes and work that we could all maybe learn from as well and share. Chief Nurse Dem Ruth May is our chief nurse here in England, and this is where I practice mainly. Although for the past 7 years, I've been moving between Northern Ireland at Queen's University Belfast and here in England. So the England in 2017, they produced a framework to encompass other professions in addition to nursing. Nursing in the UK has led the advanced practice role development, just like in many countries across the world. For 4 decades, really, they were the dominating a profession in terms of advanced practice and the processes. But in 2017, it was clear that there were other professions as well that had advanced practice or were starting to develop advanced practice. So NHS England produced a framework. At the time it was Health Education England, there was a separation between the education arm and the overall NHS England. But now they have come together. So since last year, they are now one organization. The framework was great in that it actually articulated the 4 domains of advanced practice, and it brought in a need to include other professional groups. But the risk is it came without an implementation guide, which led to variations that I'll articulate later on when I speak about my research in this area. But overall, it addressed the standardization of advanced practice within mainly NHS organizations. And whilst that was important and really that drove standards across NHS organizations, about 2/3 of nurses and other healthcare workforce work outside the NHS. So you can imagine what impact this had on the independent sector and the variations that continue to exist outside NHS settings. But also professional bodies who are either nationally, from a UK perspective or England, play a key role in advanced practice, and they are multi-professional. So from a nursing point of view, our standards are set by the Royal College of Nursing, which has both the arm of being a union as well as being a college. But they have recently revamped their standards. They've had standards for decades, and these are the standards that have always been mapped against ICN standards. And these are the standards that we were all trained against across all the 4 domains. Since 2008, they have been inclusive and looking at training at master's level. And from 2012, the standards for the RCN were strictly master's entry. And recently in 2023, they updated those standards to actually include consultant level practice, which is doctoral level practice really, and to really refine what it means for advanced practitioners from a nursing background within the United Kingdom. So they have a UK approach, and whether I am in Northern Ireland or I'm in England, I am working along the standards of the RCN of what's expected at advanced practice level. But because of the delay in regulation, for advanced practice. So advanced practice nursing here in the United Kingdom is not regulated separately from our initial registration, i.e. so I am registered as a registered nurse, and my advanced practice, even when I'm doing revalidation, is just regulated under that aspect, which obviously has brought some challenges. But however, this has meant that we put other measures to ensure safety, to ensure public protection. And this has also led to medical royal colleges being involved in credentialing, in developing curriculum standards for specialty. For example, I've got a few of them there. So the Faculty of Intensive Care Medicine has developed and led the curriculum for advanced critical care practitioners, who are referred as ACCPs. And the RACM, which is the Royal College of Emergency Medicine, led the curriculum in 2015 and revised it in 2022 for both pediatric and adult emergency care practitioners. So both these two curricula, multi-professional, i.e. which means an allied health professional, a pharmacist, or a nurse, can actually take the route to become an advanced practitioner alongside their MSc and alongside their credentialing. So how this credentialing has worked, it's because there is no separate regulation. Most of the advanced practice learners, they'll do this simultaneously with their a master's program for advanced practice. But there are now changes around this, and all the colleges are looking into changing the way how credentialing works, because strictly speaking, credentialing should be at the end of the master's program when the academic content has been covered. And it will be interesting to see how this plays out within the NMC regulatory process that I will speak about later on. The Royal College of Surgeons also has standard for those advanced practitioners working in surgical areas. So the surgical advanced clinical practice curriculum is currently under review, but it has existed since 2020. And those programs that were mapped according to surgical specialties aligned to that. There are three main groups of professional regulatory bodies that advanced practice in England can get into advanced practice, so which allows statutory regulation, which allows anybody registered with them to get into advanced practice. That's the General Pharmaceutical Council, which is the regulator for pharmacists, the NMC, regulator for nursing and midwifery, and the HCPC, which is the regulator for allied health professions. So overall, the regulatory work of professions in the UK is overseen by a body known as the Professional Standards Authority, PSA, which regulates 10 regulatory bodies. But for our discussion today, I will stick to the NMC, the Nursing and Midwifery Council, because that is where we belong. But also, without specific regulation for advanced practice, it has meant that lots of structures are put in from a health service regulation perspective. So here in England, we have the Care Quality Commission, known as the CQC, that oversees health service regulation. So from an advanced practice perspective, when a Care Quality Commission inspects a service or approves a service to deliver health services regulated activities, they would look into advanced practice from a well-led position, i.e. whether there is governance, whether there is leadership in place to facilitate the role of the advanced practice and to ensure that the public is protected by services delivered by advanced practice. Advanced practice really takes an apprenticeship type of model of training here in the UK overall. So our learners and students for advanced practice are in fact staff members. They are employed. They are working in their roles, and they need to be in a training role in order to undertake an advanced practice program, an MSc qualification, and they should be within their specialty. Entry varies, and it's normally 3 years of practice in the specialty. Some universities will stipulate 5 years of practice. But generally, really, as in many countries, most of the nurses really who come to advanced practice programs have had significant experiences. And in my own research, it was an average of 8 years for nurses. So they are really senior clinicians already. But the most important thing is that it differs in that, so we don't release people to go to university completely and they are full-time. So it's a part-time 2 to 3 years master's program done alongside one's own work, and the scope of practice is gradually changed as they progress to meet the competencies and proficiencies. And when they are signed off academically and have the MSc Advanced Practice Award, then from an employer perspective, we sign them off from a clinical practice perspective after those 3 years, and then they migrate into a full advanced practice role. So from that aspect, you can see the critical role of the employer in ensuring governance, in ensuring scope of practice in the absence of separate regulation. And that's anticipated to continue even if the NMC goes ahead and implement advanced practice regulation, because really the NMC will be looking at regulating the level of practice rather than specialty, rather than strictly determining what roles people should be doing. The Center for the Advancing Practice in England leads on the development of curriculum and accreditation of health education institutions, i.e. universities, that do masters in advanced practice. This is voluntary, so university can choose not to go through the accreditation process. But in England is much more beneficial, and most universities are either accredited or working towards that accreditation, as funding for courses is dependent on whether the university is accredited. So as an advanced practice lead, if I'm sending staff to a university, that's one consideration I need to make. If they are going to be the NHS funded, then we need to ensure that they are going to a university that meets the standards of the Center for Advancing Practice. So how do the education look like? It's been interesting in England overall because we have had advanced practice programs for decades. I mean, the initial program for advanced practice was at the Royal College of Nursing. When it started as a diploma, it moved to a Bachelor's of Science nurse practitioner, and subsequently became an MSc in advanced nurse practitioner. In London South Bank University in London, that is where this program in advanced practice in the UK started, and I had the privilege of teaching at that university as well as a senior lecturer during my time in London. But then with the changes in 2017 that I have highlighted here in England, it has meant that the language changes to include other professions within the terminology used in the programs. So most of the programs, they'll be titled as an MSc in Advanced Clinical Practice. However, there are specific specialty routes as well. And for nursing, some of them include the advanced neonatal nurse practitioner, where really is very unique, is very niche. Somebody needs to have been a neonatal nurse before they can do that program. So some of those programs have remained. And the Council of Deans is the voice of the university faculties for nursing, midwifery, and allied health. So the advanced practice work and the expert input in terms of education comes from this Council of Deans. The Association of Advanced practice educators, which was actually originated from the National Organization of Nurse Practitioner Faculties in the early 2000s. And at the time, when in its inception here in the UK, it was known as North UK. And has, as a result, also changed its name to accommodate the multi-professional educators. It's really mapped to NERV in the US, in that it is an association of program leaders of advanced practice who influence and provide expertise UK-wide in terms of advanced practice education. The education overall mirrors ASPE standards worldwide across the 4 pillars: clinical, education, leadership, and research. And the modules undertaken, which are undertaken for advanced practice, need to mirror that both in clinical practice, 50%, and in higher education modules as well. However, research has now been sort of modified around really not students not doing primary research if they are doing an MSc program, ideally, just because of the length of the period of the whole course, and to facilitate ethics approval in time. Instead, most of them are encouraged to do quality improvement projects, so similar to DNP projects, really, from a US perspective. And so as an advanced practice lead, I take responsibility and oversee that element when they are reaching that stage, to supervise, align it with governance within our organization, and ensure that they are facilitated to carry the quality improvement that they need to carry for their academic work, and that it is obviously beneficial as well to their service where they are working. From a practice perspective, as you can imagine, with multi-professional advanced practice being at different levels of maturity for different professionals, it is challenging yet fascinating to work with organizations who are implementing advanced practice roles, scaling them up, and ensuring that we meet population health needs while really producing high quality advanced practitioners. So I thought I'll give you an example of how I have approach this, given that there was no implementation guide for the 2017 framework here in NHS England. Most of you will be familiar with the paper framework, and that's how I have utilized it, but slightly different for each profession. So this exemplar, I started adapting it from my first England corporate lead position in advanced practice, which was in the West London, Southwest London NHS Trust, by really replacing the APN with multi-professional, and had really interesting conversations with Dr. Denise Bryant-Lukosis from the CAPNA in Canada, who helped me to and facilitated me in implementing this within an England perspective. Since then, I have used this methodology and this framework across 3 organizations in the UK, and one actually is outside England. What has this meant from a nursing perspective? It has meant that while I'm approaching the framework as it is outlined, some areas of nursing are at really very new stages of advanced practice, such as some specialties. So if you talk about hematology, acute critical care nurse practitioners, and that has meant that the engagement of stakeholders is even much more robust and takes longer. Whereas if I'm talking about emergency nurse practitioner and primary care nurse practitioner, where I am from, this is where advanced practice started here in the UK. It is much easier. The challenges are less to articulate the reasons for having the role, and there is clarity amongst all stakeholders. But it also means that going through the business case and supporting managers to determine the needs, to articulate the needs, and to really articulate the impact and measure the outcomes of advanced practitioners. I need to work very closely with those that are doing it for the first time in the profession, such as the dietitians or a podiatry working to advanced practice, because they bring a different, unique expertise into the arena as well. So overall, really, I have found it really helpful, whether I'm doing a recruitment into advanced practice, helping colleagues who want to come into advanced practice roles start to articulate their advanced practice and build a business case for them to go into advanced practice, using this process, the paper framework, and adapting it to an application. I, in fact, have an application form for advanced practice that's adapted from the paper framework. And this gives them an initial thought around thinking about those 4 pillars of advanced practice, how they will achieve them and how they will meet them as they progress throughout their advanced practice as well. I have, you can see I have used the 2004 framework because that brings everybody together. Whereas if I had gone for the 2016, it will be a challenge because we're looking more at outcomes. So it will be a challenge from an organizational perspective. If I'm looking at the impact, if I start looking at the impact overall, some of our colleagues will take maybe 5 years to mature into advanced practice roles, and they may feel let out. So I have opted to use the 2004. Probably in a year or two, I'll change then and in my practice in leadership and move into outcomes for everybody. I am measuring outcomes, and I encourage colleagues to measure the outcomes of advanced practice, indeed, where it has been really sustained and there has been advanced practice for a significant amount of time. Well, there has been an argument of whether the success of the nursing profession in prescribing legislation within the UK has contributed to the delayed regulation of really a separate advanced practice. I sort of agree with that to an extent as well, because from 2006, nursing has pushed prescribing legislation here in the UK and prescribing practice and made it really affordable and accessible and high quality programs to be available. And in the last decade, this has contributed to even more prescribers from other different professions, including pharmacists, physiotherapists, and paramedics. And then you would wonder then whether the way our prescribing courses was initially derived made it look very safe to have somebody prescribing, whether they didn't have a full advanced practice qualification or not. And here is the reason. So the module for the prescribing practice used to be a 3-module course, which meant 60 credits from a postgraduate certificate from a UK education perspective. And it really covered the physical assessment as a module in itself, and then the pharmacology, and then the prescribing practice before somebody could be signed off. It is regulated, so prescribing is regulated by each professional group. So those professional groups I mentioned earlier, the General Pharmaceutical Council, the HCPC, and the NMC, they provide annotation for those practitioners who have completed the prescribing practice and are eligible by law to prescribe. And we have a single framework, regardless of whether you are a nurse, a doctor, a midwife, the competency framework for all prescribers coming from the Royal Pharmaceutical Society is the one we use, and it's endorsed by all the regulators as well from an interprofessional perspective. So regulation of advanced practice and its delay is really, from a UK perspective, being referenced as having been attributed to the prescribing success. So whether we have been enemies of our own success to result in this delay in advanced practice. But however, we are on the road to regulation, which I will touch on shortly. So in 2022, the Nursing and Midwifery Council started its process in reviewing regulation of advanced practice. And this was an evidence gathering, and it was an independent commissioned work. They have recently concluded this work, and in March, they concluded that they were approving the recommendations. This council was approving the recommendations made by the Nursing and Midwifery Council to look into regulating advanced practice and to develop standards of proficiency for advanced level practice and associated program standards. So this really will mean that this is a UK-wide advanced practice approach incorporating a shared position and definition of advanced level practice. It is also going to ensure that advanced level practice requirements are included in the wider review of revalidation scheduled for next year within the Nursing and Midwifery Council Code. At present, people can revalidate. Either way, it's not mandatory that you prove that you are in advanced practice and map your work accordingly to the 4 pillars. But from next year, so this is going to be a working area for the NMC as well. There is currently ongoing work. It just concluded the phase 1 of the work, which was the evidence review. And I had the privilege of being invited to contribute to some of the work from an international nursing perspective as well, and what it means for international nurses based on my previous work and my recent research, which I would like to share with you. So the complexity of being multi-professional advanced practice in the UK, its benefits, but also its challenges. So the results I'm sharing with you today, I'm sharing the ones that are specific to nursing from the lens of being an advanced nursing practitioner. These are the results of a research I carried out as part of my education project at Queen's University Belfast in Northern Ireland. And if you recall, Northern Ireland is only nursing specific framework. And whilst I was having my education in Northern Ireland for the past 7 years, I've been practicing in England, which is a multi-professional country and multi-professional advanced practice framework in existence. However, overall, whether I'm in Northern Ireland, Wales, Scotland, or England, my standards are really mandated by the Royal College of Nursing. The Royal College of Nursing recently updated its standards for advanced level nursing practice. They are more robust. They provide accreditation as well of MSc advanced practice programs, and they also provide credentialing as well. So from a research project, my project was really an evaluation study after implementing multi-professional standards and education interventions within an NHS organization. It was a sequential mixed methods, and the results today I'm mainly sharing with you are from the qualitative part. The first quantitative part, it was a survey. So I used the SPICE-R, validated interprofessional learning survey, really to see if what we had doing, what we had done, the interventions we had implemented over a 12-month period made any changes, and investigate advanced practice learners, how they perceive that interprofessional learning, and whether that collaborative practice was effectively working, as well as supervision. There are two objectives, really: explore acceptability of embedding interprofessional collaboration, as well as investigate if interprofessional learning experiences of those multi-professional learners influence their perception of IP collaboration within work-based environment. There were three key findings from a nursing perspective that I found really fascinating, and I'm taking forward as other work streams in my next research projects. One was overall the acceptability of interprofessional learning across all professions. But key to nursing, collaborative leadership was seen as key, especially between nursing and midwifery leaders, in ensuring organizational governance, success in advanced practice education, implementation and integration of roles, and existence of scopes of practice. And this was at all levels, whether it was a service level, at organizational level. It was felt that having a chief nurse who was instrumental, and as well as a medical director was really collaborating with the nursing executive in advancing practice, was key to implementation and organizational success in advanced practice. Another interesting finding was the international educated workforce. The challenges they face in the recognition of their own qualifications when they attempt HI access. At times they are required to do additional work because they've come from countries where the standards for education and processes do not match those of the UK, or because at times academics are reluctant to really look into the transcripts of what people have been trained to do as well. But also there was issues around progression. If somebody was internationally educated and usually coming in as well from a minority ethnic group, and the recognition of their work. This has in fact been one of the areas that I am taking boldly to the next steps. It was a part of my Florence Nightingale Foundation scholarship project, in which I'll be establishing a global academy of multi-professional advanced practice alongside some of the leading institutions, universities, and academic systems for advanced practice. So keep tuned on this one, and more details as well. So with this aspect of having 4 nations with different approaches to advanced practice nursing, what does it mean then from a UK international perspective? I think really this is an interesting time for us to act locally, but think globally. What do I mean? So does my course that I develop, my curriculum here at the university that I work in the United Kingdom, prepare future advanced practitioners to work anywhere in the world? Because we know that global health doesn't mean that we have to go to another country or go to some low and middle income country, but actually global health is within wherever we are regardless. With that in mind, the Global Academy for Multi-Professional Advanced Practice Leadership, Innovation and Entrepreneurship will prepare the next leaders of advanced practice to be innovative and to really pursue the businesses of advanced practice and flourish and ensure that we have access for our patients, have got great access that is safe, that is high quality and inclusive as well. But at the same time, ensuring that our work as we advance practice within nursing is underpinned by our nursing philosophy, because we are nurses first, then advanced nurse practitioners. With that, I hope to see you in Aberdeen, and thank you for having me today.
Thank you, Bongi. Oh my gosh, that was a presentation absolutely filled with amazing information. Thank you so much for sharing your expertise with us today. So now I think it would be a great time to open up the conversation for questions and comments from our participants.
Thank you.